What's new in Medicare insurance this week? Well, there's always a lot every day, but this was a story I thought was funny, weird that I wanted to share with you, maybe warn you a little bit. And that is, you know how you have a doctor's appointment. I have a doctor's appointment today, and I've already gotten like 5 text reminders. So the lady gets all the reminders. It takes 3 months to get into the doctor. She goes to the doctor's office. There's a handwritten sign on the door that says, "We're closed. Call this number." And they had sold out to one of the largest insurance companies in the nation that is buying all the doctor's practices. And I say all, but it's it's not all, but it's a lot. So she's like, "This is weird. Like, why didn't they call me, text me, email me? Well, and why is it written on the door like this?" So she calls the number on the door. Nobody answers. The answer is they got bought out either by one of the largest insurance companies that's buying the practices or by private equity. They're buying all the doctors' offices. And it's making it harder and harder for the doctors that want to remain independent and really practice medicine to stay independent. So let's say I sold my practice, like in this instance, to an insurance company. The insurance company pays me now as an employee doctor of the insurance company more, substantially more. So let's say 25, 30% more than my competitor over here that wants to remain independent. Why would they pay me more? They own me. They don't have to pay me more. Why are they paying me more? Medicare loss ratio. Manipulation of the Medicare loss ratio. It's really interesting if you think about it. They have to spend so much of their money on care. So if they pay me more, they get essentially to keep more of their profits in their side. Very interesting. Now, what does it do to my competitor that wants to stay independent? Well, if I'm getting paid a lot more, it puts really a lot of pressure on him to sell as well. And we all know that everybody's complaining that the doctors can't really practice medicine in this environment, that they make their determination, then they go to the insurance company and they request the ability to go through with their treatment plan, and the insurance company could go, nah. So it's every year this is accelerating, and a lot of people aren't really sure what is happening. So you need to know this, one, because you're going to have to go to your own healthcare providers. 2, your clients are like, what is going on here? There's currently a kerfuffle in one state. I think it's Oregon. It's the Pacific Northwest. But one insurance company bought the hospitals and is making the other insurance company, one of their biggest competitors, out of network. So all those people are finding out after the annual election period that now they can't go to their hospitals. So they're mad. And it's loud. It's legal, right? It's not an SEP. Now, there are instances, rarely, where CMS will grant an SEP because you do not have access to your hospital. It's very rare. I've seen the data on this, and it happens very rarely in the last 5 years, just like hardly at all. It should be happening more, that when a large provider says, yeah, we're not accepted in any of these hospitals within an hour of you, that should trigger you to have an SEP to choose another plan. CMS is kind of falling asleep at the wheel on this. And you're getting the calls. Your people are really mad. So you're going, if you're lucky enough to be in the time frame where you could make a change to your Medicare Advantage plan, we can do that. But they're like, I want to go to this doctor. Well, sometimes you can't go to that doctor and have access to that hospital because of how this is shaking out. And that is not, when I just said like in Oregon, I can name like Northwest Indiana. There's a bunch of different places in the country this is shaking out. This will only accelerate. We're not seeing a lot of new companies come into Medicare Advantage. I remember back in 2008, it was just an onslaught of new competitors. We had some new ones coming into Medicare Advantage, but in general, it's been consolidated. You saw Part D. Part D used to have like 75 plans available, and now most people have like 30 plans available. That's going to continue to shrink. So Medicare Advantage, we don't have a lot of options. So it allows those big players to have a lot more leverage, and that puts pressure on you because your clients are coming to you for solutions. And if you're not in an enrollment period where you can switch them, or there's not an easy switch where they can still go to the doctor that they want and the hospital, and but that we're getting pinched, they're getting squeezed into harder and harder choices. Now, ideally, somebody has all their doctors in the network. But if you do the math on it, sometimes it's okay that we say, okay, your primary care doctor is in the network, but these two specialists are not. I'm still going to recommend this plan. Why? And you're going to have your reasons, but there's like, what about these two specialists? Well, I already asked you, how often do you see those specialists? And you already told me maybe once a year. So the math works out that you pay the full cost of your doctor visit to go see your rheumatologist. Rheumatologist is one of the problem ones. Ophthalmologist, one of the problem ones. It has to be a condition that you don't see them very much, once or twice a year, where the math can still work out that you buy this plan because the benefit package was better, with the understanding that this specialist or these several specialists will be out of network and you will pay that cost. Now, things can get worse, and you have to explain that, fully disclose this to your client, how this could play out. But it's something we never had to do in the past. It used to be, well, one plan is going to cover all your doctors, all your medications, all your specialists, and have your preferred hospital. And we're going to come down to several plans that look like that, and then we're going to help you choose which plan to enroll. Now we're in an atmosphere where maybe now we're just picking and choosing because no plan covers all your doctors, all your specialists, all your drugs, and has the other things that you might want. So we're trying to prioritize what your needs are and what's available. So you go through that, you do all that calculus, and then the companies change things mid-year. So it's really important that your clients understand that unless they have some kind of special life-changing event that allows them to change, that if things do change, they have to be flexible because you won't be able to change. And the hospital was a big one. Last year, I felt it was a watershed year of people saying, hey, I just got this letter and my hospital won't be in network anymore. More so than I've ever had in my career. And then they say, well, now what? I said, well, what is the closest hospital that is in your network? And they'll say it's over an hour and a half drive away. I don't want to drive there. In some rural areas, which this is very much exacerbated in the rural areas, they're like, yeah, it's really far away. You don't have a special exception to change plans. You can go to your hospital, which is out of network, which is expensive, or you can get in your car and drive. And there's no other options. You got to make sure that you're explaining the rules and you're explaining this is not your fault, because you don't want them getting just so frustrated and mad that they call Medicare and the complaint. Remember, a complaint to Medicare is just a complaint. They don't care that the complaint wasn't substantiated, that you didn't do anything wrong. They care that people called. They don't want people to call. They want people happy. So even though this is something people are mad about, that you have no control over, you do have control over the messaging, the education, so that they understand this before they go into Medicare Advantage. And this is also good messaging for you to be talking to them about ancillary products so that they have money coming in, not already allocated, that they could use for these unexpected things, their drug no longer being on formulary. So if you have more questions, reach out to your marketer. If you're a new agent, I know it seems overwhelming. If you're an old agent, it still seems overwhelming. Nobody expected to have so much consistent change in this industry, but that is not slowing down by any means under the new administration. If anything, it is ramping up. So hold on tight. Tune in next week. We'll keep you up to date. Thanks for watching.